Hi everyone, it's a great honor to be here for me to share with you the work we're doing in China. My name is Wei Wei. I am the National Director for Right to Play in China. So we started our work in China in 2007, and this is our 5th year. And right now in China, our work is very focused on working with children living in poverty. So we work with migrant children, we work with children from poor rural areas, we work with street children, orphans, children with disabilities, and children affected by HIV/AIDS. And our age group is not limited to just children under 6, although that's the topic I'm going to focus on today. We work with children under 6. We also work with children between 6 and 16, a lot of school education program, and also youth. That's another age group that we work with. And that gives you a map of where we're working in China. So the yellow highlighted areas are the provinces that we currently are working in China. So right now, in total, we work in 15 provinces in China and our program reaching more than 250,000 children and youth altogether. But on today's topic, actually, I'm going to focus on how do we promote early childhood care and development in extremely poor rural areas in China. And our work in early childhood care, we work with different types of children as well. We work with children in the rural areas. We also work with migrant children in the cities. And we also work with children whose lives are affected by natural disasters in China. And different numbers, different scales of program. So the program that I want to focus on today is our work in rural areas promoting early childhood care and development. It is a multi-year partnership we entered into with Nokia a few years back. In this program, the total goal is to reach 380,000 children in 24 impoverished counties all across China in the rural areas. So when you're trying to promote early childhood care and education and development in areas where it has been traditionally extremely underfunded, where the population, the low-income family percentage are very high, and also you don't have a lot of service providers to work with. What do? We ask ourselves the 4 broad questions before we started to design a program that we think can be effective. The first one is, how do we promote in an area a locally relevant child-centered methodology? There has been a lot of very effective interventions in early childhood care. But in the rural areas, in extremely poor, under-resourced areas, what is the appropriate methodology? How is your methodology locally relevant and then can be carried on after the program completes? That's a very, very important question to answer. And the second question we ask ourselves is that, what about local capacity? So, because as an NGO, the day that you phase in the community, you always have to keep in mind that you're going to leave a few years later when your program completes. Then what happens after that? What do you need to do to build up the local capacity so that when people really find the methodology that the program is trying to introduce is useful, but they have the capacity to carry it on after your program leaves? And the third question is really about social mobilization. So how can we work in the way that the NGO is not the only one who is paying for the service in the program, but all the stakeholders, parents, local government, other organizations in the local areas are also interested in chipping in providing the financial resources that's needed. And also, we also have to look at service delivery. So when you have one of the big issues about accessibility rate, that's why it's so low in rural China, is that you don't find enough service providers. It doesn't matter whether they're public funded or privately funded. You just don't have that many ECCD centers to work with at the start. So what do? How do you build a very effective service channel to build their capacity? I think those are the 4 questions that we're trying to answer. We're designing this program. And how it's happening, and this is how we do it. So when we started to work in one county, when we enter into a partnership with the local government, especially the Education Bureau, the Health Bureau, and other related government agencies, we look at what roles they have to play in the planning for multi-year development for that area. And we look at, for example, the accessibility rate is lower than 20%. Then what do we need to do if we want to make that accessibility rate into over 50%, into 80%? What are the measures that has to do? What are the, in different townships, in a time of 3 or 5 years, what are the rollout plan that has to happen? How much investment is required? How many new ECCD center has to be built, and how many teachers have to be trained? And then we started to build out that roadmap, and then we work with the government to provide the support that they need, either financial or technical. So planning is key. And then we also look at how can we develop a local trainers group, that these trainers are from local areas, they speak the local dialect, they are extremely familiar with the resources that's available in the local area, be it for nutrition, be it for teachers training, be it for all the props and the facilities they have to use if they want to use play-based, sport-based, or other type of methodology to provide ECCD care. So we would work with the government to select a group of outstanding teachers and head teachers and other trainers within the government agencies to be trained. And this group will then be the local capacity building team. So China is a huge country. There are lots of programs in different parts of the country, but a lot of the programs actually were relying on external experts, and a lot of them, the content are not relevant, and also it really requires a lot of financial resources to keep getting the support from them as program goes on. And also like simple questions like a lot of the trainers, they don't understand Mandarin. So people that you were training don't speak a different dialect. So if you have external people to work with you, even the language will become a very big issue. And we're talking about basically experts not from outside the country, but from other parts of the country. And then we also select this group of trainers, and then we look at all the teachers in be it from public funded facilities or private facilities and provide training to them. And then we provide also trainings to parents and to also health workers at the village level. And then we also provide the facilities improvement to go with the training. So once the training is complete in curriculums, what facilities, what play materials and teaching materials these teachers have to use to be able to deliver the service. And then, extremely importantly, we look at how do we make sure that all the new ECCD centers that the government is trying to build is child-friendly, is conducive to a children's development. And that knowledge almost does not exist at the local level because they're very used to building elementary schools. But how do we work with children, build facilities for children under 6? What are the facilities for children when the kindergarten has less than 100 children? What happens when you have a large facility that provides services to over 500 children? So those are all completely different issues that we have to deal with. What about the kitchens? What about the sanitation facilities, etc.? So we also work with the government to do the design and building of the playground, of the classrooms, of the entire ECCD center facility. So that gives you a nutshell on what happens on the ground level. And the program that I was talking about actually only fits for context where you're in a very populous region. So if you work in an area where you don't have a very large population, you don't have many children to work with, what do? So we look at different scenarios. And for example, we developed a mobile ECCD services for extremely remote and mountainous villages where the van will go to different areas providing services to different children in different villages. I was just reminded I only have less than 1 minute left so that I can have some time for questions. So I am going to go straight to the last step. I think there are lots of learnings I think we've drawn from the partnership in the past, but I think there's a couple of key issues I would like to reiterate because they're very important. I think one thing what makes a partnership very crucial for success is that we have to be very clear on the key performance indicators from the very beginning. How do you make sure you can measure the programs. And that has to be agreed upon since the beginning of the program rather than through the program or at the end. And the other very important point I'd like to stress is that it's, even though for different partners to have agreed upon goals, it's very important to lay out specific expectations with milestones and timelines. And also, those are the responsibilities of different parties. And we also have to clearly iterate what will happen if those responsibilities are not fulfilled. So as long as you're very clear on that, the chances for the partners who doesn't work well together will be greatly reduced. So that draws the conclusion of my presentation, and I'm open for questions. Thank you.
Again, I'm Professor Chaudhary from the National University of Singapore. You are talking about the partnership between the local government and yourself. What about the international partnership? Do you look into that possibility?
In the past, Right to Play is an international organization. We work in many different countries. And China is one of the many program countries that the organization is in. So we actually have lots of experience in promoting early childhood care in Africa and also in other parts of Asia. So if you're interested, we can share contact info, and then we can exchange and see. Yeah, thank you.
Sorry, thank you. Early childhood education is, at least in my experience, probably even more a question of educating parents rather than children.
Right.
How did you find your work with parents and caregivers? What were the challenges that you had in explaining this aspect to the constituency in China?
Sure. Working with parents and caregivers is extremely important for two reasons. One, for the China context. It's important everywhere, but I'm just trying to give you the China context. One is that parents in China extremely care about education. So because there's not enough service provider, and that's one of the things that they really find it hard in developing their children. So we actually have instances where once a quality ECCD services is developed, people from other parts of the county will actually relocate. They will move to where there is good services. And we actually, part of the program, we do a lot of parents' education. For children's parents whose children's age are between 3 and 6, a lot of them start to go to daycare centers. We do the training through that. But then for children under 3, we're not able to reach them because a lot of the program take place in the daycare center. So what we do is we actually do lots of education programs in market fairs. We also do actually infomercials on TV at the county level to promote, for example, on nutrition, on child protection, on health for children under 3. So we use many different types of methods to reach them. And for caretakers, it's actually important too, because in China, we actually have a very large population of what we call left behind children. Because of the migration, many parents actually migrate to cities and they are left to their grandparents. So working with caretakers is extremely important as well. And given to the character of the demography, usually they're grandparents, so they're older than regular parents. So a lot of the training that we provide actually tailors towards those grandparents as well. And one last question? Yeah.
My name is Deng Yai. I come from South Sudan. As you know, South Sudan is a new country, and we are going to introduce ECD into the education system, formal education system, especially in public schools. What would you advise as the conditions we need to create in order to promote ECD in South Sudan? Thank you.
Right. I think it's extremely important to recognize the diversity in culture and also locally available materials. And that's one of the key challenge we had, because in China, different parts of the country have very different cultures, and also what's available locally is very different. So I think in your program, on top of lots of universal practices, it's also important to recognize that diversity and to build components to reflect that diversity. I think that will be very important. And the other important thing is it's also really important to actually, from the very beginning of the providing of your service, to actually work with communities and parents on pricing the service. Is it going to be completely compulsory, free, provided by the government? If it's only subsidized by the government, what are the pricing structure? And where does the subsidy from government comes into? Does it come into the building of the hardware? Does it come into the training of the teachers? And then, or what? I think a lot of those requires a lot of discussion, and if you're able to enter into discussions at the beginning, it's much more effective and it will work in your favor. Yeah. Okay, thank you very much. Thank you.